here at Tracker Radio, your number one online talk radio station.
I'm sitting wondering if you're here with me.
We educate, entertain, inform, and inspire you. Follow us everywhere on social media at the Tracker Radio. Tracker Radio, keeping you on track with talk that matters.
Hello, good afternoon, and welcome to another episode of the Health Show here on Tracker Radio, the radio that keeps you on track. I still remain Dr. Purity Daniel, your host, and I trust you had a lovely weekend. Okay, on today's show, I'll be talking about osteomyelitis and septic arthritis, the two annoying entities. And I believe by the end of today's show, you'll be able to know what they are, their causes, their signs and symptoms, their management and treatment, also possible preventive measures one can take. Okay? What is osteomyelitis? Osteomyelitis simply means the inflammation of a bone caused by a bacterial organism. Early diagnosis and immediate treatment of this disease will prevent bone destruction and deformity. Interestingly, it is more common in men than in women, and no one knows why. And its incidence is higher in developing countries like, of course, Nigeria. What are the causes of osteomyelitis? Usually, bone is resistant to bacterial colonization, but events like trauma, surgery, foreign body, or placement of prosthesis may disrupt the bone integrity and cause infection. 20% of it is through hematogenous spread, that is through blood, after sepsis, overall blood infection. Okay, now the main culprits of this infection are Staphylococcus aureus and Salmonella. The bone and bone marrow, especially in sickle cell disease, are very prone to Salmonella infection, which will lead to infarction and bone death, that's necrosis of the bone. Therefore, early and specific treatment is very important in osteomyelitis, and identification of the microorganism is essential for antibiotic therapy. Inadequate therapy may lead to relapsing infection and progression to a chronic infection. Because of the lack of vascular sufficiency of the bone in chronic osteomyelitis, it can only be curable with radical resection or amputation of the limb. Now, osteomyelitis can lead to amputation, just like I said. You see what we are dealing with. So now let's talk about the symptoms and the signs of this disease. Usually for acute osteomyelitis, the symptoms last between 4 to 14 days, like symptoms like fever, fatigue, weakness, joint swelling, chills, joint pain. Then on physical examination, signs include site tenderness, that's pain, redness, swelling, limited movement or mobility of the joint or the limb. Now, as for the chronic, the symptoms last for more than 2 weeks, but the signs and symptoms are similar as that of acute osteomyelitis. Now, the complication of this disease is that it may reoccur, and in children it may impair their growth, especially when the growth plate of the bone is affected, and for adults it will cause bone destruction. Okay, now on the management and treatment, it includes laboratory investigation like blood tests, including blood culture, and then x-ray in most cases to identify the organism and to see the extent of the damage respectively. Treatment involves antibiotics based on the identification of the pathogens in the bloodstream or the blood culture that was done, which will usually last for 4 to 6 weeks. So the antibiotic therapy will last for 4 to 6 weeks. Then for chronic cases, surgery may be advised. Now, what are the preventive measures one can take? You have to take good precautions to avoid cuts, scraps, animal bites, which gives bacteria access to your body. If you get injury, any minor injury, just seek prompt treatment. Take the required medication as prescribed by your doctor. Then secondly, maintain good personal and hand hygiene. Proper hand washing technique can stop the spread of germs and microorganisms to your body. Then finally, be sure that all your vaccinations are up to date, especially for children. Okay? Alright. So now I'll be talking about septic arthritis. Septic arthritis is another killer disease. What is septic arthritis? It is a direct invasion of the joint space by various microorganisms, especially bacteria. Now, the failure to recognize and to appropriately treat septic arthritis because of their rapidly destructive nature results in significant rate of morbidity. That is, the disease rate increases and it can even lead to death. It is usually caused by bacteria. These organisms invade the joint directly by piercing or by local spread from infected tissues via blood. It is extremely common in immunosuppressed, that is, people that their immune system is suppressed, and also it's common in elderly. And just like osteomyelitis, it is also common in men. Its greatest culprit is also Staphylococcus aureus that affect mostly children and adults, while Neisseria gonorrhea affects mostly the young people who are sexually active. Yes, that's right. It's the same cause of STI, sexually transmitted infections or diseases. So the risk factors include similar history of this disease in the past, trauma, prosthesis, previous surgery, previous blood transfusion, previous sexually transmitted infection, intravenous drug abuse. These are the risk factors to septic arthritis. Now, the symptoms include the triad, that's there are 3 in 1, which include severe acute pain of the joint, fever, and restriction of movement of the affected joint. Now, the most common joints that are involved include the knees, followed by the hip, the shoulder, the ankle, the wrist, and the elbow. Now, on physical examination, it may reveal redness of the joint, painful joints, swelling of the joint, and warmth. And the management or treatment includes needle aspiration, that's sucking of the synovial fluid, that's the joint fluid, and culture for MCS, that is microscopic culture and sensitivity, to identify the organism that is responsible. Now, the blood culture and X-ray of the affected limb can also be done, and the treatment includes adequate and timely drainage of the infected joint fluid, appropriate antibiotic therapy, immobilization of the joints, and pain relief medication usually, and it involves hospital admission. Okay, so with this we've come to the end of today's show. I hope you enjoyed it. If you have any question, feel free to drop your question here at Tracker Radio comment box, and also you can also drop your comments or your questions on my Facebook wall, and I will give you a feedback. Thank you so much for listening. I still remain your humble host, Dr. Purity Daniel. Tune in every Monday by 12 p.m. to Tracker Radio, the radio that keeps you on track on talks that matter, and I believe you keep enjoying it. Stay healthy till we meet same time next week. God bless you.
Tracker Radio, keeping you on track with talk that matters.